To talk with someone about the letter you received, press 2.
I'm just terrified. I don't have the words, to express how scared I am.
It's Chris Westfall. I'm in Miami right now. My wife insisted that I take her to a Miami Dolphins game for our anniversary, so we're here just for the weekend. But something just came across the newswire that I thought is very important for you to understand, because this came from USA Today, and I've been talking about this for the last couple of weeks, all the shakeups happening in the world of Medicare Advantage. Well, this story that just came out, you really need to hear this. And I have a clip in just 1 second of hearing what this impact is having to seniors across the country. The story says hospitals, doctors drop private Medicare plans. We're talking only about Medicare Advantage plans over payment disputes. One large health system with hospitals in Virginia and Ohio this year cut off in-network access to consumers enrolled in Anthem, Blue Cross Blue Shield Medicare Advantage plans. Two doctor groups with Scripps Health in San Diego, we've been hearing a lot about this from our clients out there, are terminating contracts with private Medicare Advantage plans over concerns about payments and routine denials. A lot of you will comment when you're on a Medicare Advantage plan, you'll say, my Medicare Advantage plan has been absolutely great. I've never had any trouble whatsoever. So I'm bringing to you what's happening in the rest of the world that hasn't happened to you yet. For years, hospitals, doctors, and health insurance companies square off about how much to pay for medical services. These negotiations usually are hammered out behind the scenes, but they're becoming increasingly tense as public hospitals seek adequate payments for health insurance companies attempting to check spiraling medical bills. Experts say these disputes could be an early warning sign, and that's why I'm bringing it to you, because we're in the Medicare open enrollment period where you can choose what plan you want. Experts say that these disputes could be an early warning sign of more contract terminations ahead as hospitals and large doctor groups seek lucrative payments to offset inflation, healthcare workers' double-digit raises, and escalating prices for medical supplies. But patients are caught in the middle. These results can be devastating, as we've been hearing. Some need to switch doctors or insurance plans to potentially pay higher out-of-network rates at a time when half of Americans are struggling to afford the rising cost of medical care. Scripps Health in San Diego ended the 2024 Medicare Advantage plan contracts with two medical units called Scripps Clinic and Scripps Coastal. This decision will affect about 32,000 patients who will either need to switch Medicare Advantage plans or find new doctors. Quote, we're unfortunately on the vanguard of what I think is going to be a very ugly few years between hospitals and insurance companies, said Chris Van Gorder, president of CEO of Scripps. Hospitals are targeting Medicare Advantage plans. Many contract terminations involve hospitals rejecting terms for private Medicare Advantage insurance plans, while traditional government-run Medicare allows enrollees to choose from a wide variety of doctors and hospitals. Private Medicare Advantage restricts access through networks and impose cost-sharing requirements such as copays and deductibles. Hospitals that are rejecting private Medicare Advantage plans say, why are they doing this? They say that they don't reimburse at the same levels as traditional Medicare. Well, say it ain't so, and I've been saying that for 10 freaking years. Medicare Advantage does not reimburse at the same levels of Medicare. They delay or deny care through prior authorizations or impose other limitations. It only matters if you get sick and you need care. Otherwise, keep your Medicare Advantage plan. It's great for you. Van Gorder said Scripps' Medicare Advantage exit was a very difficult decision, but one he had to make due to now this is just San Diego, more than $75 million in annual losses with Medicare Advantage. He tried to negotiate more lucrative reimbursement rates, but those talks fizzled. While private Medicare Advantage plans are funded by government-run Medicare, they're also profitable because insurers keep the portion of those payments before paying for care. Van Gorder described private Medicare Advantage as delay, deny, or don't pay plans. That's the CEO of a doctor group saying they're called delay, deny, or don't pay plans. Would you like one of those plans? We can sell you one. They're in the business of making money, he said. Doctors, groups, and hospitals are more willing to air their frustrations publicly now over Medicare Advantage plans after think tanks and government watchdog agencies and some loudmouth on YouTube have issued critical reports about these insurers' profits and their practices, said David Lipschitz, Associate Director of Senior Policy Attorney for the Center for Medicare Advocacy. In 2022, a government watchdog report, which we brought you on this channel first, said private Medicare Advantage plans routinely reject claims that should have been paid, and they denied services found to be medically necessary. These private plans rejected nearly 1 in 5 claims. So you have a 75% chance of everything being fine when you get sick. It's unbelievable. And they denied 13% of authorizations for medical services that government-run Medicare would have allowed, said the U.S. Department of Health and Human Services Inspector General investigators. Doctors and hospitals are more willing to publicly express their frustration, Lipschitz said, because these private Medicare Advantage plans get what many people would characterize as overpayments. More than half dozen other hospital systems from Bend, Oregon to Nashville, Tennessee have announced private Medicare Advantage contract terminations or lapses. St. Charles Healthcare System in Bend, Oregon said it will end their Medicare Advantage contracts next year with Humana, HealthNet, and WellCare. Mark Hallett, Senior St. Charles Chief Clinical Officer, said sticking with those private Medicare Advantage plans would, quote, result in restrictions to patient care, longer hospital stays, and administrative burdens for doctors. That's what it's doing to doctors. So how happy are they to treat you on your plan if they can stay around in the plan? As of mid-April, Vanderbilt's hospitals, clinics, doctors exited the network of Humana's HMO Medicare Advantage plan and Kentucky Medicaid plan. The hospital advised patients to either shop for a new insurance plan or contact Humana to find an in-network provider with them.
Tonight, there are growing worries over whether or not thousands in the area will have to change their doctors. That leaves patients insured through Humana or WellCare Medicare Advantage plans, patients like Missy Maxwell, wondering what's going to happen.
To talk with someone about the letter you received, press 2.
I'm just terrified. I don't have the words, to express how scared I am.
Retired Kentucky State social worker Missy Maxwell is insured through Humana. She's a stem cell transplant patient and goes to Vanderbilt Medical every 3 months because of her rare blood disease called amyloidosis.
They had a team that deals with my disease alone.
But Vanderbilt says they will soon no longer accept Humana or WellCare Medicare Advantage plans. And that means Maxwell could be scrambling to find new doctors that will accept her insurance. What is your reaction to hearing this news?
Vanderbilt saved my life, and now they're dropping me, and it's devastating. I don't have another word for it.
If your disease is left untreated for too long, what does that look like for you?
Oh, I could go into further kidney failure, further heart failure. I'm blessed not to be on dialysis yet, but that is a real possibility.
Thank you for calling the Vanderbilt Health Patient Assistance Line for questions about changes to your Medicare Advantage plan.
We reached out to the companies to see if this could get resolved. Vanderbilt says in a statement they cannot continue to partner with plans that don't provide adequate payment to sustain increased costs. So where do you go from here then?
It is a really, in my opinion, a very concerning issue, not only my life, but hundreds of others that are, get care.
As for the other company, WellCare, who will also not be accepted as of April 1st, we reached out and hadn't heard back just yet. I'm Lydia Fielder for WSMV4.
Unreal. Quote, we can't continue to partner with insurance plans, Medicare Advantage plans, that don't reimburse us adequately, Vanderbilt said. Earlier this year, Bon Secours' contract dispute with Anthem Blue Cross Blue Shield, Medicare Advantage, put tens of thousands of Medicare Advantage beneficiaries in Virginia and in Ohio out of network. In a lawsuit filed in August, Bon Secours alleged Anthem owed the healthcare provider $93 million in unpaid claims for their patients. Last month, Bon Secours dropped the lawsuit as the two sides settled the dispute and reinstated in-network access. Who wants to be bounced in and out of a network when you're trying to get care? Despite these recent contract negotiations, industry officials representing private Medicare Advantage plans say they remain wildly popular because people don't know. More than half of the eligible Medicare people are choosing these plans, said David Allen with the, what's he with? America's Health Insurance Plans, AHIP, an industry lobbying group representing Medicare Advantage. Of course, he would say that. Patients caught in the middle. As health providers such as Scripps Health sever ties with some insurance companies, consumers are confronted with difficult decisions on how and where to get medical care. Some face the prospect of seeking out-of-network care that might cost more. Understand, if you're on a Medicare Advantage plan, and by far over 70% of the people on Medicare Advantage are just in an HMO, which means you have to go to their network, or if you go out, you pay 100% of that cost out of your pocket. Seniors in the San Diego area will be cut off from 2 Scripps Health doctor networks and are scrambling to assess their options, said Craig Gusson, an insurance broker in Carlsbad. People are really upset. Seniors on Medicare have the option to choose a new plan during the Medicare open enrollment period, which runs from October to December 7th, Pearl Harbor Day, my birthday. Seniors can choose traditional government-run Medicare or switch to another private Medicare Advantage plan. But some of these scenarios are catching seniors off guard. Let me read you a comment that I just got this morning on the YouTube channel. A person said, Hi Cap says, Scripps leaving Medicare Advantage does not trigger guarantee issue event. How can that be? That's true, it does not. I have an aunt, 87 years old, and a father, 86 years old, that this affects. They want to keep their Scripps doctor in treatment. I don't think they can pass underwriting. I'm looking forward to the video you'll do on this topic. Well, here it is. 33,000 people in San Diego affected. By the way, Alexis in your office helped me with my Medigap plan. Good job, Alexis. This is affecting real people. Last week, I did a video talking about California's underwriting holiday. That's with one insurance company. It's not state law. It's one insurance company doing it through the end of 2023. And they've done it for the last couple of years. So depending on when you're watching this video, it may apply to you. And that one insurance company is accepting people onto a Medigap plan, not a Medicare Advantage plan, with no underwriting whatsoever. And if you want help with that, you can reach out to us and we'll try to help you before December 31st when that thing expires. Gusson has been working long days answering calls. This is the insurance broker in Carlsbad, from Scripps Health patients who want to know what their options may be. You know why that is, Mr. Gusson? It's because you put all your patients, all your clients on Medicare Advantage. And this is what happens to you as an insurance agent if you put all your eggs in the basket of Medicare Advantage, which I know a lot of agents are doing that now. He's answering tons of calls of people freaking out. They don't know what to do. Some are willing to keep their existing private Medicare Advantage plans and just change doctors. No big deal. Others want to switch Medicare insurers. Private Medicare Advantage plans must maintain adequate networks of providers. So if a hospital drops an insurance plan's network, that can raise questions about whether the insurance plan had enough in-network providers for enrollees, 𝗲𝗏𝗁 said. If more hospitals and doctors continue to drop private Medicare Advantage plans, quote, that further begs the question whether, in fact, the network is adequate. While the Center for Medicare and Medicaid Services, CMS, oversees Medicare Advantage plans, the federal agency does not become involved in contract disputes. They're not there for you because you're not in original Medicare anymore. The federal agency is prohibited from interfering in contract disputes or dictating reimbursement rates that private Medicare Advantage plans negotiate with health systems. Wasn't that nice? Brad Gingrich is a vice president at Ensemble Health Partners, which describes itself as a tech-driven revenue cycle management company. Gingrich said, terminating a contract is your last option. He's talking about the hospitals leaving the Medicare Advantage plans. When negotiating with private insurers, hospitals are adopting harder negotiating tactics with Medicare Advantage plans because that's where insurers are making their money and refusing to really work in good faith. So he's saying that these Medicare Advantage companies are not acting in good faith. That's what 𝗲𝗏𝗁 said. That's what Scripps said. That's what all these hospital systems, Bon Secours, St. Charles Health System, hospital system in Bend, Oregon, Nashville, Tennessee, all over the country. I've been bringing this stuff to you as it comes out. And I'm just telling you, we offer all plans, all the different types of plans. We offer Medicare Advantage plans, Medicare supplement plans. I just want you to be educated beyond what most insurance agents are just saying, which is, hey, sign here or give me a verbal signature, and now you can have this plan that has zero premium. There's always more to the story, and I'm going to continue to bring it to you. Now listen to what's happening about this Scripps thing happening right now, and thanks for watching.
Here, Chris.
Yeah, and January 1st. And what we're hearing is that it's not so much people being able to find a new healthcare provider. It's that they've been working with specialists that know their story, that know what they're going through. And now that needs to be replaced, so to speak. And that's what one man told us is his biggest issue.
It's just a burden. It took a lot of work to find what I consider to be the right specialist.
And that's David Lombardi. He has a chronic condition that he sees a specialist with Scripps for. He and thousands of others got that letter that we just showed you that told them that Scripps will no longer accept Medicare Advantage plans at Scripps Coastal and Scripps clinics starting next year. That means they'll have to find a new plan or pay thousands to stay with their current specialists and doctors. Medicare Advantage plans are privately run versions of the federal government's Medicare program, mainly for people 65 and older. Now, we spoke with the president and CEO of 𝗵𝗵𝐻IS Insurance Services. They told us that there is something that you can do in order to try to advocate for yourself. You can actually try to decide where it is that you want to go. So you don't need to stay necessarily and pay that money, but what you can do is speak up about where you want to go next.
It's not like you're going to be left in the cold on January 1. You're going to still have your plan, and that plan is going to switch you to another provider. Members need to take a role and say, wait, don't just put me wherever. Let me choose.
Now, we did reach out to Scripps Health, and they did send us a statement. This is part of it. It reads, quote, Scripps and health systems across the country are facing unprecedented financial pressures. We are looking at all we do and, when necessary, making difficult decisions to ensure that we can continue to meet the needs of the community that we serve. Now, you can read the entire statement at CBS8.com. For now, we are going to send things